Hi, YouTube people! Welcome to my channel, Upright with Dr. Polley. My name is Dr. Polley and I am a GP in South Africa, and I am wanting to share my experiences. Can you please? I have a condition called POTS dysautonomia, as well as hypermobile Ehlers-Danlos syndrome and ADHD. And these are all topics that I want to go into more detail with and share my experiences, my symptoms, my struggles, and as a doctor, how that affects me, and also to share advice and how some of the things I've learned over the last year can help all of you. So just to jump in, what is POTS dysautonomia? So POTS is a condition that affects your autonomic nervous system. So POTS stands for Postural Orthostatic Tachycardia syndrome. So basically, your heart rate goes up when you stand up, abnormally high, and it stays high. And essentially what it is it's a problem with your body's ability to regulate blood flow up to your brain and to your organs. And so to compensate for that, your heart rate goes up to try and get that blood flow going. The problem with this is that having that really high heart rate can cause symptoms and issues like dizziness, racing heart, obviously feeling it racing. And the symptoms that I have include fatigue. That's like the biggest one. So I'm pretty much always tired because it's just baseline, it's like always there, but it does fluctuate in severity. So fatigue is the biggest one. Brain fog comes along with that, so very forgetful. My memory is pretty bad. I forget conversations that I've had. I forget appointments, and I forget what I want to say. I get dizzy when I stand up, so it varies from just feeling uncomfortable standing up to having like black vision, like I can't see anything and need to like stabilize myself on a wall or like on my legs, like with my hands on my knees to until that vision comes back. I get temperature dysregulation, so like I get very hot sometimes, even when it's not that hot, and I get very cold sometimes, regardless of what the weather's doing. There's some days where I'll be lying, like 2 days ago, I was lying on my couch and I was like sweating and I was like, oh, it's so hot. It's winter in South Africa. And then I got up and walked to the kitchen and I just was like, oh, it's so cold. And then I had like goosebumps everywhere. And it's not as though I was like lying with a blanket or anything on the couch. I was literally wearing exactly the same thing, just high. My temperature is just dysregulated. Then I get blood pooling. So that basically means that the sun is coming. The blood collects in my legs and in my hands if they're in a downward position, and that can look like red and swollen, and just it's not always painful. Sometimes it's painful if it's really bad, but most of the time it's just uncomfortable. And then sometimes they get this like purplish blue discoloration, and that's more like it can be like a numb, cold feeling. And then I get short of breath. So on mild exertion, like I'll just feel like I can't get enough air in, or kind of need to breathe a lot harder than you should for just like standing up and walking to your bedroom. I'm currently just starting to feel nauseous. So nausea is another one of my symptoms that I get frequently, and I thankfully have great meds for this. Otherwise I would not be coping. Headaches, I get headaches frequently. They range from mild kind of background headaches to migraine-like headaches, like one-sided pulsatile, can't function kind of headache. Then chest pain. I sometimes get chest pain when I stand up, usually more when I'm tired. When my nervous system is more tired, the chest pain is worse. Exercise intolerance. Yeah, I don't know, I think those are it. Those are the main ones. There's probably more that I've forgotten, but those are the main ones. It definitely impacts my ability to function in life. So the fatigue and all of the symptoms has resulted in me only being able to work and see patients twice a week for like an hour or two at a time, depending on the day. And if I go over that, then the symptoms get a lot worse and I don't recover by the next time I need to see patients. And so it's been quite a big adjustment. It's one of the reasons I want to start this channel, is because I kind of have a lot more time at home when I'm horizontal and not doing much to edit videos, and I actually enjoy that as a hobby. I'm only able to ride my horse twice a week, and that's on a good week. Most of the weeks end up aiming for 2 or 3 times and only actually getting to ride once, and then the rides are a lot shorter and I can't do as much, and then I don't have nearly as many friends. That is like a sad laugh because it's true. Yeah, there's, I think, been a pruning of friendships. Not everyone can, I guess, handle being friends with someone who doesn't have anything to give back, or doesn't have a lot to give back. Yeah, a lot of friendships have kind of fallen away, and that's a little bit sad. But at the same time, I do have many amazing friends who have stuck around and have been supportive in just being with me while I'm horizontal, making me food, helping me move, checking in on me, those kind of things. So there have been big changes in my life, and I want to kind of share some of those with you and how I've navigated that. So if you have not liked this video, like it. Even if you didn't like it. Post a comment, ask me questions, share your own experiences. If you have PITES or Ehlers-Danlos syndrome or chronic fatigue syndrome or whatever chronic illness, because there's a lot of overlap in how it affects your life. ADHD, if you're a Christian, if you just want to type a flower or a heart, then that's cool. And subscribe so that you know when I'm gonna post another video, which may be next week, maybe 3 months time. Okay, bye.